Are movement imbalances bad? In fact, what are they? I'm Dr. Mike Israetel of Renaissance Periodization, and let's talk about movement imbalances. I think we're not the first little dog and pony show on this one because a lot of people have talked about this, and a lot of it's been good and some of it's been not so great. So first thing we do is define movement imbalance. In this context, we mean bilateral asymmetry of movement. It's when one side of your body moves notably differently from another side of your body. For example, you lean more on one leg during squatting. When you're doing lunges, one toe points out further than the other. So you step this way with one foot and this way with one foot. Like this one's just cocked out this way. One elbow tucked a little bit more, one flaring a little bit more on the bench press. Something you can notice. That's an example of essentially bilateral asymmetry of movement. And that's what most people are talking about when they say, oh, I think I've got like a movement imbalance. What do I do about it? So before we do anything about it or decide what to do, we have to separate or differentiate movement imbalances into essentially two big categories. That's to figure out if it's a clinical grade movement imbalance or a subclinical grade movement imbalance. So clinical grade imbalance is when the imbalance is such a high degree that it causes gross dysfunction or pain. Like you actually have trouble walking, trouble lifting weights, trouble getting in and out of your car, and or it hurts to do all those things even if you can do them kind of correctly, right? A more gym-related example is you squat more on one leg than the other, push more from one leg, and the dominant knee that you're using more is just hurting more and more and more. And you're like, God damn it, I know it's because I'm squatting off this leg more. Every squat's kind of like a single leg squat at some point, and that may be not sustainable. On the other end of the spectrum is the subclinical movement imbalance, which is such a low degree of imbalance that it causes no pain or dysfunction. So the example is you squat more on the leg than the other, just like the last one, but there's no pain, there's no discomfort, and your squat is improving just fine. And it's like, oh, like my knee's always off tilted to the right a little bit. And someone's like, oh yeah, does that cause you a problem? You're like, I don't think so. It doesn't feel weird. It's just like when I watch videos, it's off a little bit, right? So that's subclinical. Clinical is when it's actually causing problems. So given that that's the case, what are your options? What are you to do? If the imbalance is clinical grade, which means it's causing you pain or dysfunction in everyday life or in lifting, you should seek out a sports medicine doctor that can direct you to the best course of diagnosis and treatment. Okay? Why a doctor? Because some of the diagnoses and treatments can be very complex and unintuitive, and you may not just be able to do some rehab videos off of YouTube and get better. For example, it could be that you have some kind of structure or some scar tissue literally impinging on a nerve, which is making your left bicep smaller than your right bicep. And no number of fucking curls for the left one is ever going to bring it up to size. They image it, and you go, holy shit, you got some kind of thing there that we can take out, and it'll probably relieve pressure on the fucking motor nerve, and your muscles will grow more. And you're like, oh, and they do the surgery, and they do it, and then 2 weeks later, you're like, I can feel my bicep more. It feels so strong. And then 2 months later, it's just as big as the right one and problem solved. Thing is, you wouldn't know that that was the case if you were just like, yeah, man, my left bicep's small. I got to bring it up. Like, well, you don't even know why, like what the damage is, right? It's like if a fighter pilot is like accelerating the engines of his aircraft and one of the engines is feeling a bit sluggish, he's like, I got to go faster, and just jams the fucking thing, like more power. Like that could blow up the engine. Like if it's feeling sluggish, then the first thing you got to do is like, why? And maybe like you do diagnostics and there's a loose component in there, like, holy shit, turn off the engine, use the other one, land as soon as possible so the whole thing doesn't blow up. Just because something's underperforming doesn't mean just training it more is the answer, right? It doesn't even mean training less is the answer. If it's serious and clinical and it's causing real big problems, you have to go through the medical network. Huge recommendation. Now, if the balance is subclinical, you have a few other options. Okay, it's not bothering you, it's not painful. It's just some shit you see on your Instagram videos. Once you post them, you're like, that looks kind of weird, right? First option is you can just leave it alone and pay no mind. I have like a gazillion imbalances, and I've had them for 20 years. I've never had an injury related to any single one of them, and everything's fine, right? Another cool thing is almost everyone, essentially everyone, if you sort of zoom down in enough, has imbalances. And the literature on do imbalances cause injury has been very well explored. And the best answer is if it's clinical, yes. If it's subclinical, literally no. Just not a thing. So if you're trying to fix it, you have to ask, like, what's the benefit of me fixing it? And if there's really no benefit, why are you going to change your training to fix it? Now, If you do want to fix it, the best method to do it is the following. You reduce the load and the relative effort a bit. So you don't go as close to failure for a while in that exercise, and you reduce the load so that it's more manageable and you can control the technique better. And then you focus on every single rep being as perfectly balanced as possible. So if your elbow tucks in more on this bench and flares here, use a lighter weight, not as close to failure, and be like, okay, same tuck, same tuck, same tuck, same tuck, press. Same tuck. I know it wants to go in, but I'm going to push it out. I'm going to pull this one in. Same tuck, press. Okay. And you're actually just learning a new technique. You're going to learn this technique and practice it for weeks as you slowly increase load and relative effort. First, make sure it's pretty automatic, that it happens all the time. Start increasing load and relative effort for a while. And then after a month or two, your asymmetry may be highly reduced, which would be just like less asymmetry, or it could be gone entirely. And then ta-da, like you did a really good thing. Now, this technique renorming, has a few caveats that come with it. If you're a competitive athlete, you really only want to do the renorming of the technique in the off season, because when it's close to competition, whatever technique produces the most force is what you're going to have to go with. So if you're a competitive athlete or like, you're a bodybuilder, you need good hard workouts coming close to the show. You can't just do like, oh, I'm relearning how to squat. No. That's for deep off season. So once deep off season is done, if you did what you could to renorm, now you just got to go with the flow. If it's subclinical, of course. This is all subclinical stuff. Clinical, you go to the doctor. Now, last question for this discussion is, should you do isolation work for the less contributing side? Like if you're curling a barbell and you notice that your right arm comes up a little faster than your left, and your left one kind of feels like it accumulates lactic acid faster and is clearly the limiting factor, should you do more work for your left to bring it up? Well, maybe, but we don't know for sure that it's that muscle's weakness that's causing the asymmetry necessarily directly, that it's the muscular tissue that's insufficiently large and strong by itself that's causing that problem. It could be a bunch of things you may have not thought of, and I sure as hell didn't think of these shits. First, it could be just neural programming. Like, not everyone's nervous system is perfectly designed, and sometimes your body just gives more oomph to one arm than the other. And you can make the other arm stronger, but you'll still run into that same problem many times. It could be compensating for slightly different leverages, right? The thing is, your shoulders might be tilted like this all the time, just a little bit, just enough so that in order to have full function in both arms, your right arm has to become stronger because it actually goes through a larger range of motion because you're tilted into it instead of away from it. If you fix this bicep and make it stronger, you're actually generating an asymmetry. The asymmetry and strength fixed the asymmetry. You're just measuring it wrong. You're not measuring arm to arm. You're measuring two arms at the same time. So for the challenges the right arm faces, it's actually exactly as strong as it needs to be. And for the challenges the left arm faces, it's actually better leveraged for those. And if you combine the leverage into a barbell, then all of a sudden it tilts and all of a sudden it looks like your left is behind your right, but that may not be the case. And it may be the case, but it may not be the case. So you're not exactly 100% sure. Another really interesting one is it could be compensating for an asymmetry somewhere else in the chain. Let's imagine for a second that your left tricep is a lot stronger than your right, notably stronger. Not clinically, but notably. It's bigger, it's stronger, like, fuck, I need to bring up my right, or bring my left down. I'm going to stop training for a while. But what you don't notice is that your right front delt is rather large, and your left front delt is a little smaller than it should be because the degree of neural innervation to it, just by genetics, or you had an accident when you were 2 and someone hit you on the shoulder by accident and the nerves kind of deadened, your front delt isn't as strong as it's supposed to be. It's not as strong as this one. So because of you're lifting the same load, usually barbells, dumbbells, same weight, you've been lifting it your whole life or your whole training life and trying to keep the velocity the same and everything, your tricep, something had to give. So maybe your pec is a little stronger on this side and your triceps a little stronger because they don't have the benefit of relying on the front delt as much. Here, your triceps normal size, pec's normal size, because your front delt is actually as jacked as it's supposed to be. So if you say, fuck man, my fucking left tricep's too strong, I'm going to train it a little easier, you're actually creating an imbalance. The imbalance locally at this muscle actually sort of, how do I put this best? It reduces the systemic imbalance, which is the real gnarly part you want to care about, especially if you're interested in injury risk. And if you say, I really got to train my right tricep, then your right tricep's going to get so strong that, it's going to look cool, it's going to look bigger, but this is the problem you never addressed, and there may be no addressing it, but if you just let this tricep sort of deteriorate on you, you could start to have real trouble pressing with this arm at all. And you're like, God damn it, I'm like even weaker, but how do I have a bigger tricep but I'm weaker on presses? Because you didn't think about all the other muscles in the chain. For complex movements like deadlifts or whatever, there could be like 10 different muscles in the chain. You just might not know which one of them are how strong, how weak. So you got to be really careful about like, oh, I'll just make XYZ muscles stronger. That's not exactly the case every single time. Now, if you really intend on figuring out if this works, what you have to do is you drop the bilateral work to maintenance volume. So if my left pec is smaller than my right pec, what I'm going to do is I'm just going to do like 3 or 4 sets of presses every week to keep the right pec just as strong and big as it ever was. And then the rest of the work that week for the left pec is going to be unilateral work. This pec, trained between minimum effective volume and maximum recoverable, it grows over a few months. This pec stays the same size, and eventually this left pec is going to be as big as the right pec. If that works, then great, it worked. What I just want you to know is that it's no guarantee. So don't just go in there and assume like if someone's like, yeah, man, my left quad looks a lot smaller than my right, and I'm moving kind of weird. The obvious answer isn't to make your right quad weaker or your left quad bigger. There may not be an obvious answer, so you have to give it some thought. You have to try technique renorming first. But if that doesn't work and you really want to explore, then you can go from there and try this isolation work, everything down to maintenance volume to actually make a big impact. And if it does, great. If it doesn't, you're probably fine. And if it's ever clinical, go see a doctor. Folks, give that some thought. Let me know what you think in the comments. See you next time for the next video.